There is a humanitarian crisis facing children in the Middle East. Thousands of children living in the occupied West Bank and Gaza Strip, southern Lebanon, and war-torn Iraq are in need of advanced medical care that is not available to them locally. The Palestine Children's Relief Fund is a non-profit organization that was established to address this humanitarian crisis by locating cost-free medical care and other urgent aid for injured and sick children in the region. Established in 1991, the PCRF's initial mission was to arrange free treatment for Palestinian children injured in the First Intifada by placing them in U.S. hospitals. Since then, hundreds of children have traveled for millions of dollars worth of donated medical care at top hospitals in North America, Europe, and parts of the Middle East. We rely on volunteers in the local communities to help house and care for these children during this urgent care, as many of them travel without their families. In 1997, the PCRF began sending volunteer medical missions to the Middle East to provide free surgical care for sick and injured children, as well as expert training for local medical personnel. These medical teams consist of doctors and nurses from all over the world with specialties in the areas of cardiac surgery, orthopedic surgery, plastic and reconstructive surgery, eye surgery, vascular surgery, maxillofacial surgery, urology, and neurosurgery. Many of these specialized services are currently not available through local caregivers, and the PCRF is often the only hope for many of these poor children. Throughout the years, thousands of children have been treated by these visiting teams. Each year, hundreds of babies are born in the West Bank and Gaza Strip with congenital heart disease. In response, the PCRF is building the only pediatric cardiac surgery program in Palestine. Without access to a life-saving operation, many of these children would needlessly suffer and die. Since 1998, PCRF visiting teams have provided hundreds of life-saving operations at Maqasid Hospital on the Mount of Olives, while training local doctors and building hospital infrastructure. Our goal is to have a permanent congenital heart surgery program in Palestine that will be run by local doctors who will be able to treat their own patients in their own hospital. In addition to providing urgent medical care for injured and sick children from all over the Middle East, the PCRF also provides other forms of humanitarian aid and services in the region. We currently run summer camps for disabled youths, provide powder milk for malnutrition children, and run a child sponsorship program that provides disabled children with medicine. We continue to distribute highly specialized wheelchairs for disabled people in Palestine, Lebanon, and Syria, with over 2,000 distributed in the region. We also run a women's empowerment program in Lebanon's refugee camps, and we are currently working to provide free eyeglasses for every child who needs them for school. Over 15 years later, the PCRF continues to work hard to address the humanitarian crisis facing children in the Middle East. With a hard-working staff in all districts of Palestine and Lebanon, we are able to manage and efficiently run our own programs on the ground. We estimate that our donors get a $50 return for every $1 donated in terms of medical care and services provided. We need your help to ensure that the poor children in Palestine, Lebanon, Iraq, and Syria get the help they desperately need. By reaching out and providing medical care, food, and help to children who are adversely affected by war and occupation in the region, we can ensure that these children have a future free of pain and suffering. However, we cannot do that alone. The PCRF depends on volunteers all over the world to join us in our relief efforts. Won't you please join us to ensure that these children are not forgotten?